to Kenya now. As they close in on 100 days of their industrial strike, medical doctors and the government have been given a 24-hour deadline to hammer out an agreement to end the strike, of course, by the court. On the 7th of March, Kenya's president ruled out any further talks with doctors, throwing the current court-ordered talks into question.
We must remember that we still remain a developing country with a long way to go. We're not going to be able to achieve what you want overnight.
Now, doctors, however, aren't buying it. They point out that the health ministry in this developing economy has not been able to account for at least $290 million spent between July 2010 and June 2015. Now, in those 5 fiscal years, the health ministry has consistently gotten adverse or qualified audit opinions. Both sides agree that there is a need for better quality, more accessible public health care for all Kenyan citizens. But how should that be achieved? Well, that's a question CGTN's Ramanyang put to his panel earlier on.
Well, I actually think that for a country whose citizens earn $1,500, our biggest problem with healthcare will always be money. First, we are too small an economy that is poorly managed, and the little money that's available, as we've all agreed, is being stolen. So what we're going to do is we're going to have a health service, that the public health service side, that's going to struggle to do a lot with less. So the first point I will say is that we cannot then respond to that issue by throwing money at it.
It's not a cash problem.
It's not necessarily, well, part of it is a cash problem, but even the little cash that we have then has to be used well. So for instance, reprioritizing even within the health sector itself. We bought some expensive MRI machines that went up there. That is an argument that we need to...
But we didn't have the specialists to run them, did we?
Precisely.
I mean, our priorities are lopsided. And so we leased those machines, and recently we couldn't pay one of the...
Yeah, and NG actually, levied penalties on the government to that
Precisely, because we couldn't. So obviously, part of that is to reprioritize. But for a country whose citizens earn $1,500 per year, that's less than $150 a month, we have to be clear about what our priorities should be. And our priorities should actually be primary healthcare.
But that sounds like an argument to spend a lot more, because correct me if I'm wrong, Dr. Wala, but as I understand it, when you start talking about primary healthcare, that's basically things to do with sanitation. You're dealing with diseases like diarrhea, malaria, things that ideally in 2017 we shouldn't even be talking about.
Yes. Yeah.
But you see, it tells you why this is a systemic, it's a systems failure, because part of the reason we're dealing with malaria and health is because we haven't cleaned up the environment, water is not clean to begin with, so people are suffering simple infections. Half the time when kids are not in school, it's because of an infection, as you mentioned, diarrhea or stuff like that. So basically it's all a systems thing. So that even as a doctor is working in specific places, what gets to a doctor would be things that actually require that level of
Right, so if I understand you correctly, to summarize, invest a lot more on the public sanitation side to take care of a lot of this opportunistic disease burdens that really shouldn't even be there to begin with.
Precisely.
So that then Dr. Wala and her colleagues don't have to start dealing with simple things that shouldn't be in existence.
Yeah, precisely. I mean, so for instance, that doctors are delivering children, okay? But they don't have gloves. But we are buying MRI machines.
Which we don't need, not at the moment anyway. Dr. Wala, so what's your vision for healthcare? Because yes, we have to balance off these twin needs. On one hand, yes, we need public healthcare, but how do we pay for it?
I think the secret lies in a national social health insurance fund. Right now, the NHIF is collecting, if I'm not wrong, 8 billion a month. Most of that goes to recurrent costs within that NHIF structure. Now, if we can just channel those monies towards what Kwame correctly said, preventive medicine, because as a country, we are dealing with now 3 tragedies: the communicable diseases, which can easily be prevented, the non-communicable, which are the cancers and the rest, and then we have road crashes, which are totally preventable problems. Have programs that address this, have budget lines. If you go to the counties right now, there are no budget lines for, say, water and sanitation and hygiene. They are still using the same old models that the Ministry of Health has been using, the central government has been using. So have programs that specifically target these preventive mechanisms. The other thing we can look at is sin tax. So everyone who consumes cigarettes pays a certain amount of tax that goes straight to health.
But isn't that already, well, not directly anyway,
it
but I mean, sin
it's
taxes for cigarettes and beer pretty high.
Yeah, but the problem is it doesn't go to health, because the reason why you should be taxing is a health reason. It's not really because you're going to damage your body or you're going to harm someone, maybe in a state of inebriation and all that. So if we channel these monies, we are actually able to afford a universal healthcare scheme where you can tier the covers. So you have the basic package that's accessible to everyone, and then you have the middle level, and then a higher level, which if I want and my employer is not addressing, I just top it up for myself. We are also losing a lot of revenue to countries in terms of referrals being paid by the taxpayer.